Welcome to Not Just a Dentist, the podcast where we look beyond the surface of dentistry and into the connection between oral health, whole body health, confidence, and longevity. I'm Raimondi, prosthodontist and co-founder of One Manhattan Dental in New York City.
And I'm Dr. Marc Sclafani, also a prosthodontist and the other co-founder of One Manhattan Dental. In each episode, we'll bring more than 5 decades of combined experience to help you understand how great dentistry can support your health, longevity, and quality of life.
From full mouth reconstruction and cosmetic dentistry to prevention, technology, and oral systemic health, our goal is simple: to show why dentistry is never just about teeth.
Because this is not just a dentist. Happy to be with you this morning.
So happy.
A different format. We're facing each other, a little bit more of a conversation.
Yeah, we have a lot going on right now. We've got a different setup. We have 3 cameras. We started with 1 camera. One iPhone maybe. We started when we first started doing this back in like 2020, 2021. 1 camera. Where were we? In operatory, maybe?
We're in our rooms doing this.
In our treatment rooms. Now we're down the hole from our treatment rooms. That's why we're wearing scrubs. We're still in the office. We're going to cover a couple different things today, and we'll start with the first. And it's a conversation that I wonder with our own patients, not even patients outside of our practice, but I think there's a large percentage of our patients that do not realize that we're prosthodontists and what that means. So a lot of people know the difference between their internist and their surgeon, or their regular doctor and their ENT. But I don't think a lot of our patients, or a lot of people in general, understand. I think it's a fault of our profession and specialty, but a lot of people understand the difference between a specialty dentist, like a prosthodontist, and an untrained, formal trained dentist, like a general dentist, cosmetic dentist, restorative dentist. And so we almost like to think of it as being the architects of your mouth, the longevity doctor, someone who can help you through the course of your life. And when problems arise, how do we think about your mouth as a whole, and how do we tie that to your entire body?
Great point. You know, like other specialties, patients know what an orthodontist is, right? They know what an oral surgeon is to take out their teeth, an endodontist for root canals, but a prosthodontist is probably the least recognized specialty. I think we said there's only 2% of dentists that are prosthodontists in the United States. Small number compared to the amount of general dentists are there. You also mentioned cosmetic dentists, restorative dentists. That's not a recognized specialty.
It's not our formal specialty.
It's not. You can call yourself a cosmetic dentist. You could be passionate about doing veneers and porcelain crowns and porcelain inlays, but it's not a recognized specialty. Prosthodontists are trained in advanced dentistry to do porcelain veneers, crowns, implants, any type of restorative dentistry.
So in dental school, we're immersed on a foundation of academic courses and a foundation of preclinical classes, right? We're doing everything that we do in the clinic, and models and on typodonts, where are models of teeth, and then mannequins, and you get tested on these static models, and it's like you're drilling plastic in the room. And then you get introduced to clinic, and you're rotating through every clinic. A little bit of a root canal specialty, a little orthodontics, a little pediatric. You're in a hospital somewhere. You're rotating through different clinics, getting a foundation. And then the average dentist goes out into the world with the foundation of a little bit of everything. For you and I, after dental school, what did you do to get this foundation up, or build your foundation broader and higher in the vertical sense, to maybe that would be different when you go out into the real world? What was your prosthodontic training like?
Yeah, well, Rob, that's a great point, because in dental school, you're doing a single crown. Maybe if you're lucky, you do a bridge. You're only restoring a tooth here, a tooth there.
I think I did 1 bridge in undergrad.
You're not restoring a patient's whole mouth. You're looking at that one individual tooth, or 2 teeth maybe if they're next to each other. I had a passion for restorative dentistry. I knew right from the start I didn't want to do root canals. I wasn't passionate about orthodontics. I mean, I had a clinical professor. His name was Dr. Peter Neff, who was an advocate on occlusion. And occlusion is how the teeth come together, how the bite comes together. So after dental school, my residency training was with this Dr. Neff, who introduced me to prosthodontics, introduced me to what the TMJ was, what occlusion was, and it gave me the basis of a full mouth reconstruction. So I did a full year learning about occlusion, learning about the bite, learning about how to make appliances to get somebody's bite more comfortable, and that gave me the foundation to move into prosthodontics. So I did 1 year with Dr. Neff, learning about TMJ, occlusion, and then I followed that up with formal prosthodontic training at NYU after Georgetown.
Let's talk about what a prosthodontic training is. So right now, it's a 3-year program after school. So you and I bolted a year training after dental school. I did a hospital training where I did a further depth of education in each of the specialties. And then I specialized in prost. Our prosthodontic training was very similar of the clinical experience working under people. So talk a little bit, I think, about what that means. So like practically, again, formal training versus informal training, or a restorative dentist can get to a point where they're very capable of taking care of some of the larger issues. It just takes a lot more time because they have to go through the courses and they don't have the mentorship maybe like you and I did. So what was your, if you could summarize it, like what was your clinical experience and your academic experience and your prosthodontic specialty training program that allowed you to become a specialist of the mouth, the TMJ, the entire mouth, right? We don't look at one tooth, you're looking at the entire system.
Exactly what you said. Even though our careers are maybe 15 years apart or so, they're so parallel. I did my training at NYU. You did yours at the VA program, which was across the street from NYU. And you had the same lecturers that I had because those courses were combined, even though we were 15 years apart. But what you said is we learn to treat the whole mouth, right? We just don't look at an individual tooth. We look at the bite, we look at the muscles, we look at the levels of the bone. The whole mouth tells a story. You know, somebody without proper training may just look at it like a chapter in a book, where we're looking at the entire book. Now, there's plenty of dentists that go for continuing education courses and can kind of get to that level. But from the start, we were trained to look at the entire mouth. You know, we didn't go into private practice first and make mistakes. We went right into prosthodontic training right after the school. Right, you came out of the VA program, and what was your first job when you left the VA program?
I worked with a couple prost practices, these fee-for-service, high-rent practices out the gate. Although I had one practice, I was trying to fill my days working in insurance practice, and it was different universes.
And I remember what you told me, what you did on your off days. You kind of visited every prosthodontic practice.
Yeah, every practice when I was in my program and such, because what was happening is for us, when I was training, you'd have your academics at NYU in the morning, you'd have 2 hours of coursework, and then you'd go to the clinic at the VA hospital, and there you'd work under prosthodontists, and they would help direct you with your cases. Now, there's a sense of independence it's like supervision, but not such a control like in dental school. They would help you work up the cases, they would watch you treat the patients, they would check your lab work, they would check you through the entire process. So every time you'd get off course, you'd have the opportunity to learn why you should be doing something different than maybe you got off course. They did help, it was like bumper bowling without the ball going into the gutter, right? You might start veering in the wrong direction, but they're there through every step of the way, and you build this foundation of treating patients with options. You know, one of my professors, Frank Tuminelli, one of our good friends, would always say, the difference between a prosthodontist and an untrained restorative dentist is the untrained restorative dentist has one way to fix the problem. The prosthodontist has many. And then when problems happen along treatment, they have many ways to solve the problem. Whereas an untrained person, once they get off course and they're with that one solution, they don't know how to get back on track. So it gives you a wider foundation and a higher vertical along the process of treating somebody of different ways. And then the other thing is things go wrong in those treatments when you're treating someone trying to restore their entire mouth. You get to deal with those emergencies and those problems in a supervised way in a program before you even get out into the real world. So when you actually start treating patients in the real world, like you and I are very comfortable with complicated cases and treatments. And when things go wrong, you and I can fit a patient in and fix it pretty quickly because we've done it so many times in the worst environments with less resources, right?
I like what you said, that there's more than one way. How many times have you told me a patient came to you and they came from another dentist and they need 10 fillings and they need a crown here, and you find sometimes they don't need any work at all?
You did that last week. Last week you were talking with the patient and they had a treatment plan, and you said to them, well, you could do this stuff, but it's a little bit like going to a surgeon if you recommend a surgery. You don't need me to make you better. You polished a few things very subtly. Instead of this patient going through a 10-month treatment and spending a lot of money and a lot of time, you were able to fix their problem in like a 20, 30-minute appointment because you have the lens and the training to see the picture and fix the problem simply. You don't need to do that big thing sometimes. Knowing how to do that big stuff also teaches you when not to do that.
And sometimes we're not needed. Sometimes a patient comes to us and they think their mouth needs a full rehab, and maybe they just need to be sent to an orthodontist and put the teeth in the right place and then evaluate the bite.
Right? It's like every bit of tooth surface you can save for now can have an effect in the longevity of their mouth.
Correct.
Part of going through that training for you and I is that we didn't have any family members that were dentists. It was you and I were out there trying to become the best, and we didn't have a direct familial mentor like a lot of people may have. Like a lot of dentists in my class in dental school had family members that were dentists. So I think you and I, part of that was searching for that mentorship. Being a first-generation dentist, going through formal training, you can find some mentors to help you along. And I would encourage people, dentists who haven't had the privilege that you and I have had, to seek out that mentorship through like the Spear Track, COIS, and there's a lot of educational centers that are run really well that offer, like the American Academy, even Cosmetic Dentistry has like mentorship programs. There's a lot of mentorship programs out there. I think people need them. You have to source them and find them and hunt for them. They're not out there just to be picked. But I would encourage anyone without the formal training that you and I have to find that now. I mean, reach out to us. We're happy to help any way we can to point people in the right direction.
It's not too late.
We're
always learning.
We have a few doctors in our office right now that we're mentoring.
Yeah.
That we're not asking for much from, but they might use our practice a little bit, and we're trying to help them along to take care of patients and give people what they need and deserve.
Yeah, I agree. Sometimes I feel less is more. After 30 years or so doing this, I'm most proud of the cases where I didn't have to pick up my drill and sometimes talk patients out of treatment.
So Marc, one of the benefits that you have is after your specialty training, you've been working in practice for some decades.
So, I tell patients, I'm not just looking at your teeth today. I'm looking where they're going to be in 20 years from now. That's looking at it through a prosthodontic lens. We've seen enough cases. We've seen enough individual problems, and you start recognizing trajectories, right? You see where the mouth is heading.
Yeah, especially seeing thousands of patients over tens and tens of years. You get to recognize patterns.
You predict the problem before it happens.
You could predict the problem before it happens, and you could prevent it with your treatment.
Correct.
Right? I try to tell patients, when I talk about a new patient, I go, listen, my day is spent doing two things, either cleaning up someone else's mess or preventing my own. That's it.
Great.
The mess might be from the patient's mess.
Great statement. So, Rob, you mentioned looking at the whole system, right? What do you mean by that? Not just looking at one individual tooth.
Well, the beauty of the lens that you get once you get a higher picture, you can pull yourself out and not just look at a micro problem, but you can look at it from the whole. So you might be starting looking at a tooth, and you're looking at the arch, you're looking at the lower teeth and the upper teeth and lower teeth, and then you're looking at the tongue, the lip, the mouth, the facial structure, the airway, and then that person's health, emotional health, where they are emotionally, how they want to be taken care of, their philosophy for taking care of themselves, their health. How is their health being impacted by their teeth? How is their teeth being impacted by their mouth? Is this patient on bisphosphonates? Is it somebody who has to pre-medicate for every appointment? Is it someone who has a terminal illness? Is it someone who's is 75, but every family member has lived to 102, and they've got a bunch of problems at 75 that are questionable on how to treat them. So I think the benefit of having some more training, getting in more reps, maybe it's like the 10,000 hour rule, but getting more in, you almost learn from your mistakes. You learn from your successes, hopefully, both of them, and helped you to try to treat that person to the best way possible with your abilities and their condition, their wants, their needs, and what they're capable of.
I agree with you. You learn from your mistakes, but it starts with the training. Without the proper training or continuing education, you can continually make the same mistakes.
The person who inspired me to become a prosthodontist, Daniel Connie, a fixed prosthodontist, a military guy, a Navy guy, who then went to the Buffalo Dental School, had a saying. The first day he taught fixed pros, Marc. You'd see these slides. I have them on my computer. I'll show you them. The preparation. This guy, the most beautiful pros I've seen to this day. Like art. It's art. He had this saying. It was like, clinical judgment is the compounding result of doing things without clinical judgment. Something like that. Like so it's like, you gain the judgment by not having the judgment and learning it. So when we were going through specialty training, if you think about it, I think of us as prosthodontists as a longevity dentist, right? Who better can take a patient through their life and keep them stable, healthy, connect with other specialists to make sure that we're complementing their overall health and getting them to live as long as they can through the health of their mouth. No one does it better than we do. And I feel like prosthodontists are the longevity dentists. Everyone's tracking sleep, VO2 max, DEXA scans. What are we tracking, right? They're tracking so many health markers, but they're not really
what
tracking.
are they not tracking?
They're not really tracking what's happening with tooth loss and gum loss, any periodontal disease.
Are they going to be able to eat at 80 years old, right? If you're not eating properly, you're not aging properly.
How many patients do we see with worn enamel with dentin showing through, and they're in their 50s and 60s?
Some of them are younger, right? I've seen 20-year-olds that have grinded through their enamel. You mentioned longevity. It's funny that you say that. You saw a patient last week that was 9 years old. I saw a patient that was 99 years old, right? We primarily don't treat kids, but sometimes there's problems at a younger age that need to be addressed by a prosthodontist. This patient at 9 years old was sent to you by a general dentist that wasn't sure how to handle the case on a 9-year-old.
And everything I was thinking about while treating that 9-year-old, I sit down, you're present with it. When you're not, you assess the problem, you sit down, and you go 9, 19, 29, 39, 49, 59, 69. What am I doing right now? And you're so present with that. And then you can take the literature, you take the situation, and you can make what you think is the best decision for the 39-year-old person who's 9-year-old in front of you.
Correct. So because the treatment on a 9-year-old would be different than what you might have done on a 39-year-old.
I mean, there's no way, you have to tie it together, right?
Exactly.
There's a bunch of things where I'm seeing right now in the longevity space is people are posting their health age or their whatever, like there's tests, age tests. I'm 50, but I'm really 39. Like biological age versus chronological age. Well, we look at patients and think about what is the age of their teeth in relationship to their actual chronological age. And how do we keep that tooth age aging properly or fix the problems to get that age down to below their chronological age?
Well, you mentioned earlier, everybody's looking at trying not to age with their VO2 max, their sleep scores and so forth, but no one's actually treating how the face is collapsing. We're the one who rebuilds the mouth. We'll talk about when a patient loses vertical dimension.
What is vertical dimension?
What vertical dimension is, in simple terms for a non-dentist, if you would measure from the bottom of your nose to the tip of your chin. Right, from the bottom of your nose to the tip of your chin. Now, if you've seen a patient that has no dentures in the mouth, right? Everybody's seen that.
Right,
no
lips
teeth.
look
no teeth, no dentures, nothing, just gums. And that space between the bottom of the nose to the tip of the chin has collapsed. So when that collapses, what happens? What happens to the facial muscles? What happens to the structure of the face? It all collapses, right? So we as architects of the mouth are rebuilding that vertical dimension to where they originally were. You could talk about everybody goes for fillers, Botox, even surgery to kind of rebuild the elasticity in the skin. But none of that really works if your face is collapsed, if you've lost vertical dimension.
Right. You have an aesthetic age of your face and a functional age because your vertical dimension may be collapsed from loss of tooth surface. And then the way you eat, speak, and look is impacted. But by restoring that with restorations, you can also take 10 years off of their physical appearance and also restore functionality. So you're lowering their dental age, their aesthetic age, by restoring their teeth.
And that's giving them better ability to chew, better ability to feel more confident about themselves. And this is not always just built out with veneers. There's cosmetic dentists that talk about bringing the veneers outward, filling the buccal corridor, which will fill your smile, but it will not help you if your face is collapsed and when the vertical dimension needs to be increased.
Right. The other part around this is, besides vertical dimension loss that can occur, is also gum and bone loss that can occur that can affect the way your mouth is functioning. And again, the age of your mouth and then the appearance of your mouth. If you're losing bone, it can affect the way your teeth look long in the teeth. It can affect the way your teeth look. It also can affect the way your face looks as you lose volume of bone. And it can affect the way you function and eat. It's this whole package that goes together.
So when you say losing bone, you're also talking about losing teeth. And you mentioned to me recently replacing teeth with a bridge compared to an implant.
Right. Yeah. So the mistake could be that you spend a lot of time and money on different things and you're avoiding your mouth. You're not looking at your mouth, or the people who are taking care of your mouth don't even see it. Right. So by restoring your mouth, your teeth, implants, crowns, veneers, when they need to be done, can help to take years off of your biological age or your chronological age compared to it, however you want to word it, in these these posts that people are posting, the hook lines. But I think it's something that people should consider to having the right dental professionals evaluate their situation.
But losing the vertical dimension is not just an aesthetic issue. It's going to affect the way you eat. It's going to possibly affect the airway if your bite is collapsed. Go back to that patient that I had the other day, our patient that we were treating together. His hat said 99 and counting. 99 years old, and he's wearing a denture, a full upper denture, and the teeth were worn down to nothing. And his wife was like, he can't eat anymore. He can't eat. She doesn't care about what he looks like at this point. It was more of a function with his denture. So at 99 years old, we fabricate him a new denture. It's going to affect his health. He's going to be able to eat better. He's going to be able to chew through his food. She said every time he went to eat, he would just take that denture out and he would just eat with his gums.
They're going out to restaurants, and he's 99. She's a little younger, and they're still going to go into restaurants. But because of this problem that you're fixing, the problem causes him not to go to restaurants.
Correct.
It's changing his social age.
Yeah. Yeah.
So now by restoring his vertical dimension and his functionality and the position of his teeth, his ability to chew, you're actually making him younger in a way. To use it, that term, you're restoring his ability to be healthy from a nutrition standpoint and also to be healthy from a social standpoint. Get out of the house, go to a restaurant, talk to people who work there, maybe you bump into a friend or talk to the table next to you. I think we would encourage people to look at their mouth as part of their health span. Part of their longevity philosophy and longevity plan should be their mouth. And not, of course, the number one part of that is inflammation, but then also tying together the appearance of your teeth, the functionality of your teeth, the role your teeth have in your own psychology around yourself. Marc, how many times do you get a male, a husband, who's restoring their teeth and fixing their teeth, and it's driven by their wife? Or I had a patient yesterday, they both were in for cleanings yesterday, and he's losing a front tooth because of resorption. And I'm showing it to him, and he's like, I don't really care so much. Show my wife. So his wife was in the lab yesterday with our lab team looking at our mock-ups. But so he's at this moment, we're treating him in next month, at this moment, he's kind of downplaying the role of the appearance of his teeth that he has in his mouth and how he identifies with himself. But how many of these people have you fixed? And then they say, when they're back 6 months later, I never realized how much my teeth and my smile or the way my teeth were chipped impacted me.
It's the best thing they've ever done. Right?
I love smiling now. I love the way I feel about it. The wife will come in and will hug us and be like, we go to weddings and he's smiling at pictures finally and he's talking to more people. He has more energy.
Yeah, it's funny that you say that because men seem like they don't care as much about it, but once they fix it and address the problem.
We might downplay it as men or as women who just don't identify with appearance at times. And we're not overstating appearance, but I'm just saying there's a role with restoring the way somebody looks. So I'm not saying making them look fake. I'm saying restoring the way they look when their teeth were younger looking and giving them back that appearance and functionality and biological health and removing inflammation can have a holistic impact in someone's longevity.
On the other hand, you have women that'll spend hundreds of $1,000s on facelift, anti-aging process, and they're not looking at the real problem that's aging, which is their teeth. We spoke earlier about restoring vertical dimension. Vertical dimension, restoring it doesn't just improve your smile, it can make you look 10 years younger at the same time. There's a patient that I think you saw last week that you did 10 veneers on. Actually, you rebuilt her whole bite. You restored her vertical dimension. And by doing this, she looks 10 years younger and you didn't do anything to her skin.
Right. When you restore a key part of their face, you can restore their age and their self, their energy and their well-being, their health around everything. And I think that it's one of the biggest longevity tools that we have as dentists to do such a tool when indicated.
It can take the wrinkles out of someone's skin. You know, when I see someone whose bite is collapsed, sometimes I'll take 2 pieces of cotton and place them in the teeth. And what it does, it opens up the lips a little bit more. It opens up the cheeks a little bit more and kind of gives them a sneak peek what they used to look like.
Implants can preserve bone. Doing proper restorations can preserve the tooth surface, even by doing restoration. And by doing all this, we can help to preserve someone's well-being and their life.
You know, Rob, after all our training, 30 years of practice, the thing that surprises me the most is when I speak to a patient about their dental problems, and it's actually their sleep problems. The grinding, the cracked teeth, the jaw pain. It's not about the teeth, it's about the airway. So why don't you start talking about how the airway affects us and how grinding is just not something we just do. There's a reason that people are grinding.
Every day I have a patient who has a sleep tracker on. And every day I also tell a patient they should wear a sleep tracker who isn't wearing one. Sleep is such an important part of the foundation of health. It's the number one thing I focus on in my health before I focus on everything else. If I can't master sleep, I can't master anything else. And I think that with your mouth has a big relationship with your sleep, whether it's the volume of air that you can get through because of your jaw relationship that then constricts your airway, and or you're grinding too much during the night, having pain in the morning because either you can't breathe or because you have stress issues that you're taking out, your body takes out on his teeth, one or the other. There's two different issues that are happening when you're grinding, and we don't know which one is happening. These are affecting your sleep. These are affecting your body's ability to heal, recover, your brain's ability to break off waste. It's been shown that having inadequate sleep is dementia, heart disease risk, your overall cognitive ability to function throughout your day, your immune system. So the relationship that we have with patients when we're diagnosing sleep problems or they're coming to us with them and then treating them properly is a huge part in someone's health and in their lifespan, their health span, their just well-being, and also the trajectory of the health of their mouth.
Great, well said. So the sleep is something new that wasn't really talked about. I've been doing this 30 years. I've had formal training in TMJ and splint therapy, and I've made mouth guards all my life. And I've changed my tune of how I'm making them and how I'm diagnosing this. The jaw clenching during the sleep isn't just something random. It's usually related to the airway narrowing. It has to do with the anatomy of the airway. The brain is sending us a signal, and it's a survival mechanism to try to get air down. We're thrusting the jaw forward. People don't just randomly grind. They're doing it as a survival mechanism. The grinding is a symptom of it. And just treating it with a mouth guard is not the answer. It's like just giving somebody an Advil that are constantly getting headaches.
Grinding may be an airway problem.
Correct. Grind probably is an airway problem.
Most people think it's stress, but it may also be airway issues, like you're saying. It's such an important thing for people to realize.
And the beauty of this, it can now be diagnosed on a CT scan. Some of the orthodontists that we work with are diagnosing this at a young age. You could see a child who's going to have an airway problem. You could start expanding that arch as a child that will alleviate problems of grinding and clenching in the future. Most people have just been told to wear a night guard for years, but nobody really looked at why they're grinding.
In some people, they just think it's what they do, or they can definitely associate it with stress. So the night guard can fix you grinding your teeth. It'll protect your teeth, but it's not really fixing the problem.
Exactly.
It's protecting your teeth as you kind of drive down the road too fast and off the road. Like you have a helmet on, you're still in that environment of unsafe something. So it's at least protecting your teeth, but it's not addressing the problem.
And you could see this right away on an initial consult with a patient. You'll see flattened cusps. You'll see cracks in the enamel. You'll see abfractions at the gum line. These are kind of fingerprints of nighttime grinding. Most of it does happen at nighttime when we're laying back and our jaw goes into a reclined position, and that's when we're trying to gasp for air to try to breathe at night. I like these sleep trackers, whatever you use. My mattress tracks my sleep score. My ring, you can have a bracelet. I think formally you can go for a sleep study to really see how many times you're waking up at night. And there's ways that we could treat this. And it's not just a formal mouth guard. By putting a mouth guard in a patient's mouth can actually make the symptoms worse. The jaw still can fall backwards. It can close the airway more. We're moving into different appliances that bring the jaw forward. It advances the lower jaw to help open up the airway.
Right. So a patient comes to us and they say, I think my sleep is an issue, and my doctor told me I should talk with my dentist. What we're looking at is a couple things, right? Nasal breathing, mouth breathing is number one. Start in the front of your face and work your way back. So do they have a problem where they need to see an ENT that they can't get air through their nose? There's just a restriction of volume. Or is it a postural issue where they're mouth breathers habitually because of a past problem, or because it's just the way they've been breathing or something else? Or is it that there's an anatomical issue that their jaw is protruded and they can't get the volume back, right? This isn't just overweight older men's disease. This could be just, we see this in a lot of yoga moms or younger people too, that are in the best shape. You have to think of it as not just the aesthetic appearance of somebody or the physical appearance, but also the anatomical that you can't really assess by looking at someone. Then you have their TMJ, and then you have any other issues beyond just their physical structures.
Our job is to find out why they're grinding. Sometimes it's the airway that you mentioned. Sometimes it's the bite. Sometimes it's both.
Your dentist could be the first person to catch sleep apnea, and we can be the person to treat it. I was talking with a patient yesterday who she's going to see her ENT because she's a mouth breather and she's been mouth taping at night. And she's not really sure if it's working because her sleep numbers are still terrible. She wears an Oura ring and her sleep numbers are still really bad. And I go, well, how long did you sleep for? She goes, 9 hours a night. Which is, well, I'm in bed 9 hours, but my sleep doesn't represent that. And I'm mouth taping. I don't understand what's going on. I go, can you breathe adequately through your nose? She goes, I don't know if I can. I go, what does that mean? You don't know. If you don't know, she goes, I feel it's hard to breathe through my nose. That's why I'm a mouth breather. I go, okay, we're going to do 2 things. When you're awake, you're going to work on your tongue posture, the tone of your tongue, pressing, not pushing, pressing your palate in that position, which is how you should be sleeping. And she's going to see an ENT next week just to start there. And then the next thing on our list is to consider a home sleep study. If the ENT clears her and said it's not a volume issue, restricted air, we're going to then see that, because she was like, do I need a night guard? Do I need a sleep appliance? And we don't know. So mouth breathing is great if there's a postural issue and the volume of air that you can get through your nose is adequate. If you truly have a sleep issue, mouth taping could be the worst thing that you do.
Mouth taping, you're saying, could be the worst thing to do if they have a sleep problem, if they have an airway problem, right? Because they'll get no air through their nose.
You started in the foundation of a TMJ program before the sleep stuff was a conversation. So imagine someone doesn't have a sleep issue, but yet they have TMJ issues. How does a night guard help that? If you need a night guard, which many of our patients do not have sleep issues and need a night guard.
So what I've seen from my training is the jaw joint, the TMJ, is where everything converges. The sleep, the airway, the bite, stress, posture, it connects all these systems together. Where some dentists just treat each problem in isolation, you're looking at the whole picture. When someone's clenching and grinding, first thing that usually happens is the muscles give first. They'll have muscle spasms, they'll have spasms in the joint. Usually it's the masseter muscles, which are the largest muscles in the cheeks. It can extend above the zygoma arch to the temporalis muscles. So a lot of it starts with muscle stress, and then the next thing is the teeth that go. You'll start seeing cracks in the teeth. You'll start seeing wear in the enamel. When the teeth wear down more, now we spoke earlier about vertical dimension, we're losing tooth height. So it's just a chain reaction. It just continues to get worse.
Right, so then those patients are grinding on their back teeth. Muscularly, what does that do?
When they're grinding on the back teeth, you're going to create more muscle spasms. And where a mouth guard could help there is that you are increasing the vertical dimension. You're taking some stress off the muscles. You're taking stress off the joint. So if they do not have a sleep problem, it's going to give them relief in the muscles. But I do recommend everybody monitoring their sleep score. You don't want to give someone an appliance where they have a sleep issue.
Right. And people who do not have a sleep issue, appliance is a great thing to give them.
Fantastic. We still make a lot of conventional appliances.
That's why we're part of the sleep team, was the way I look at my role in our patient's life, right? You and I talk with their physicians, their sleep doctors, and we talk with the people analyzing the data from some sleep studies. We take cone beam scans, dental CAT scans to evaluate the airway. We tie it all together, and as a collaborative approach, we can make a decision on how to take care of that person. A CPAP machine, an appliance, and other habitual things that change around sleep hygiene to get them to sleep really successfully.
So the cone beam that you mentioned is going to give you a 3-dimensional picture of the airway to see. You can actually measure the airflow. A CPAP machine, a lot of people don't like that. They're cumbersome, but it's probably the best way to force oxygen into the airway. And the alternative to that, which we started making a lot of, we teamed up with Atria Health and doing sleep studies with them and have been making sleep appliances. What the sleep apnea appliance is, it's not just an upper guard, it's an upper and lower guard that are connected together that prevents the jaw from falling backwards, which opens up the airway.
And then you take a sleep study, your home sleep study, with the device in your mouth.
Correct.
And you track the before and after to make sure that it's in the right position, it's making the impact.
Yes.
But you're not just giving and forgetting. So by treating sleep issues, headaches, grinding, clenching the proper way, we can help in a way to save their life, to increase years of their life and moments and memories of their families.
And prevent further tooth loss, further tooth breakdown, which all ties it together. So my advice is to get some type of sleep tracker. If you think you're grinding or clenching, whether it be one of those bracelets, whether it be a ring, one of those is going to help. I had a patient the other day who it looked exactly like an Oura ring, but it was a knockoff version. He said he spent $60 on it.
Cool.
He goes, the problem is I have to charge it every night.
Fine. That's cool.
But the
That's
data,
cool.
they actually, the platform was exactly the same.
And that's cool. And it'll only get cheaper. And with AI, it'll only get better.
I got an 89 last night. I got a 91 the night before.
I got an 85 last night, 79 the night before, but a 94 the night before.
Well, that was your wife's birthday.
Yeah, it was. Yeah, fair.
He had
fair.
a glass of wine or two, maybe.
Fair enough. I did a glass of wine with that night. So if your teeth are chipping, you're grinding your teeth, think about also sleep issues, not just grinding. And if you are grinding and chipping your front teeth, you're having issues, don't ignore it.
Yeah.
Talk to your medical doctor, talk to your dentist, see what kind of sleep training they have, and solve it. We're here for you. We're here to get you healthier, support you.
This is great. Please keep feeding us with new topics that we could talk about.
Let us know what's working. Let us know what's not. And connect with us, whether you're a dentist or a non-dentist.
Or a future patient.
Just let us know how we can help you and shoot us a message. And we're here to be your partners. Not, we're not your dentists legally, but to be your partners and at least maybe help you out in some issues.
Perfectly said. Thank you.
All right, brother.